right, welcome back. Thank you so much for staying with us. You're watching Morning Cafe. This morning, we have Joshua Gitonga from the National Syndemic Diseases Control Council, that is the NSDCC. First of all, Joshua is an epidemiologist and a monitoring and evaluation specialist at the NSDCC. Good to see you again, Joshua.
Great to see you again, too.
All right, you're talking about engaging men and boys, of course, as allies in ending HIV and, of course, gender-based violence. And before we even started this conversation, Joshua, I was already asking you, why do you consider men and boys crucial in, just bringing up this conversation on why and how we can end HIV, of course, by the year 2030?
Thank you so much for having me. Looking at men, I want to believe that each one of us, at least there is that one man that you love, that you care, and you wish that they live long and a healthy life. For sure, each one of us. Possibly that person might be a father, might be a husband, might be a brother. I think and the list continues.
Yeah.
So this is one person that we value. And our desire and wish is that they live long so that we are able to see them. But I was reviewing this and I saw a statement that really kind of struck me. It said that currently there are more empty seats at a family gathering. Why? Because we are losing many men. So when you look at the deaths, when it comes to men, they are quite high. And therefore, that is the starting point. What we do? The question is, have we left men behind? Yes. When we look at issues of deaths, as I've said, like when it comes to HIV, we know that women have a higher burden.
Yes.
More women live with HIV, mostly for women.
Okay.
But now what is happening is that when it comes to deaths, now the deaths are disproportionate. Though more women live with HIV, but then more men die from HIV. So we register more deaths when it comes to men than when it comes to women. I think that's one challenge, because we are saying that they are the ones who are, they are fewer who are living with HIV. But when you look at the proportion of them that are dying because of the same, it's higher. But that can be traced back to quite a number of things. Like number one, health-seeking behavior.
Yes.
We always know really for men, going to the hospital, possibly that pain must be quite a lot. Let's look at one of the program areas, like HIV testing. It will be good to note that actually men do not go for testing. Like only 27% have gone for testing.
The HIV testing?
Yeah, for HIV testing. Whereas when we come to women, because of course of their health-seeking behavior, because of childbearing, they find themselves going to the hospital very often. Now that is not enough, because we want to look at the results of that test. What we are seeing currently is that the number that are turning positive to HIV is increasing among men, and especially the younger generation. So it becomes a problem. That's why we're saying really we can't lose the young generation because of HIV. Why? Because a number of them do not know their status. That will end up bringing quite a number of things. Number one, they will not know their status, and therefore they continue transmitting. That becomes a challenge. When you're trying to prevent, then you realize that now they're the same, who are starting to kind of infect. The other thing that we also get is that they don't start treatment. Of course, that leads to ill health. Their health comes down. So those are some of the things that we look at, and they're pointing to this aspect that men are lagging behind, and really we are taking advantage of this week of awareness creation for us to be able to talk about men and to request men to come out. One, do screening. There are many opportunities that are there to screen. I can tell you, there are many times, like when it comes to chronic diseases, how many men have we seen just going around their business and they fall and die? Why? Because there was possibly an underlying condition that was never identified. Why? Because men will not go to the hospital. And that screening becomes very important because it can be life-saving. Whether it is HIV, we need to do that screening. Screening here is testing. Think of things like hypertension, things like diabetes. And we have really quite a high proportion of men that are living with undiagnosed hypertension, diabetes. Looking at TB, it is quite not good to note that actually men are more affected than women when it comes to TB. Yes, and one of the reasons is that, remember, if you have undiagnosed HIV, it makes the body weak. So what happens is that you become more prone to the other disease areas, which include things like TB, and that's why we are seeing also men, when it comes to the men living with the TB, also becoming more. So basically, that is around the health-seeking behavior. The other thing is that always what you talk about, being men, issues of masculinity, toxic masculinity. And the challenge with that is that men are taught to be men. And I've come to realize that most of the times that men are taught to be men, but never taught when not to be, when they need any attention. For example, can you imagine of a man going to see a counselor? What we always see is that for ladies, when there's something disturbing them, they'll have one option. Talk to somebody or possibly seek a counselor. But the many of the men, even the ones who are seated here, by the time that you see a man has been convinced to go and see a counselor, which they perceive as a sign of weakness, it takes more time.
But Joshua, is it easier for you? If you're talking about men, you've made an example of even men that we have in studio, but for you, from where you sit, is it easier for you to also just unlearn, you know, this, what we said, toxic masculinity, and just seek help when you need to seek help?
We need to do what you've just said. We need to unlearn and relearn. Unlearning is one of the most difficult things to do. And therefore, it's not only the ones who are here in the studio, it is even the other Kenyans who are men, and Joshua, who is also seated here, who at times will find himself enduring some pain and discomfort, which at times is a pointer to an underlying bigger problem. And if then Joshua doesn't seek, what happens is that by the time then I'm seeking help, you realize that it is too late. I'll give you two examples of people who are known to me. Somebody takes a vehicle, driving. At that point, some of the chronic conditions, like hypertension, high blood pressure, is just high there. And they drive. By the time they are reaching, they just stop somewhere. By then, it hands to something like a stroke. And it's something that would have been arrested if that was found there before. How many men also will we see? They go and sleep. They have been having this discomfort, but take no attention. And then what will happen at that point? They'll say it's only a headache, just a small discomfort. But I think we need to unlearn that issue of men are strong, because it is not actually strength. The strength is understanding and seeking health care. Looking at the statistics, we know that when it comes to things like depression and suicide, let me just mention that. Men are almost 8 times likely to commit than women. So when you look at the totality of these things, we are saying that it is the time that we are able to bring attention to the man. Because as I started by saying, we don't want a sitting of the family and within that table, the man is not there. Why? Possibly the man has left, and because of something that was underlying that was not noticed, possibly the person was thought to be a man, and by the end of the day, they succumbed to the same. So these are some of the things that really point to us asking ourselves those many questions, like what we need to do when it comes to the man. But we have a whole week where the discussion is looking at the health of men. As National Systemic Diseases Control Council, given the mandate to look at systemic diseases, these are a number of chronic diseases. What we've done is that we've come up with a framework to guide the country. And within that framework, it targets the health and well-being of men and boys. Why? Because when you look at all the statistics, health statistics, they point to one thing, that there is a challenge and a problem with man when it comes to healthcare. And therefore, we are just mobilizing and creating awareness and saying that let's take that opportunity in our gatherings, whether it is having forums. For example, one challenge that would be there is like possibly this being, as we enter the third week of June, is issues around men, where issues culminate to the Father's Day.
Men's mental health,
men's mental health, the other well-being. Those are some of the things that we are discussing. Possibly the main challenge would be these people that we are saying that we love them and they are with us. Do we take time to create awareness, whether it's health, whether it is issues of general health, mental health, and any other specific health area, including HIV, whereby then we can be able to get them to seek and get the attention that is required. So there is a whole framework that we developed as a country, and we call upon everybody. I mean, organizations, whether they are religious organizations, media. Thank you for the great work that you're doing at TV47. That's great. Just to create that awareness. We need to save the man. And the saving is, look at that son of yours. Look at the father. Look at your brother. Look at that uncle that you love. Look at that other mentor who has mentored your mentor. And they need help. Otherwise, we may find ourselves in that table and they will not be seated there.
So Joshua, how does the data look like? Because if you're talking about, now we need to engage men in this conversation about HIV and just how to encourage better health-seeking behavior, what does the data look like between men and women in regards to the HIV prevalence cases that are now here with us, to what we're looking at in 2025?
Thank you so much. Looking at the statistics that we have, I'll start by saying that, number one, I talked about, let me start with HIV.
Yes.
With HIV, we know that the pool of people living with HIV, or those living with HIV, majority are women. So what we do, and the task that has been given to us, is to ensure that the person who is living with HIV, they lead good life, like any other person. The lifespan should be the same, whether you're living with HIV or not HIV. Therefore, we try to ensure that this person, the death does not occur. But now, looking at women and men are fewer, but what is happening is that majority of them are dying. And that's what the statistics are pointing to. Why? Because number one, they are not screening, they are not testing. Number two, they are not starting treatment. When they start treatment, they are not adhering. I think it's a series of things, and that is really backed by data that we have at NSTCC just shows that really we need to pay attention. Let's look at issues of treatment for HIV. Those are ARVs.
Yeah.
Do you know, apart from children, men are the others who are not on treatment? Quite a number of them. When others, we have almost 90%, over 94%, 95%, when it comes to ART among men, it's lower. It's almost, it's at ranges of 90. When it comes to retention, especially for the young people, let me look at 15 to 24. When you look at 15 to 24, it's already at 75. Now, remember, this is very critical. When we talk when we think of retention among people on ART, because it does two things. Number one, if you don't adhere properly, you build resistance. So it means the drug that you're using later on will not become effective even when you use it. Now that, of course, takes out some of the drugs that one can be able to use, which is really a high risk. Number two, you start developing ill health. Remember, there is what we used to see when we started issues of HIV, and I think this becomes critical. Yeah. When we started HIV, you just needed to see somebody who seems to be weak, very thin, with rashes,
bones.
I think bony, and we could say this is person living with HIV.
Yes.
But that is not the case right now. After introducing treatment, I think that a person living with HIV will lead a life like any other Kenyan. Now, why is this important? It's because, remember, we've talked about young people. Now, young people have never seen that. It is possibly older people like us who knew that the impact and effect of HIV and the devastation that was there. There are many people who are buried because of the same. But they have been born when there is treatment, and therefore for them, when you tell them about HIV, at times they are not very sure. They are not able to conceive what can happen. And I think that in itself ends up affecting, and they don't see the need to take the drugs as they have been prescribed. Remember, when you're taking ARVs, you take them for life. It's daily, and you have to take them for life. And that's why we are saying the prevention becomes critical. If we don't prevent, of course, then we end up possibly being infected. But we are saying that is not the end. Why? Because there's treatment. Adhere to treatment. And once one adheres to treatment, you live the life, you become productive as usual. So that is the issue of mortality or deaths. Let me look at issues to do with tuberculosis. Now, tuberculosis, we always say, is very close to HIV. And there's one thing that we've noted about viruses and bacteria. They have known how to work together. What happens is that HIV sets in, it breaks down immunity, so the immunity in the body goes down. Then what happens? TB now comes in. Why? Because the first blow was the HIV. Then now any other condition just sets in an easier way. I think if all of us, we need to realize that, and realize that really we also need to do things differently. The way they work together there, we manage all of them together, and that becomes critical. So just to say is that men represented 65% of TB diagnosis. This is according to population surveys that we have, like for 2022, and that's 65%. Of course, that tells us that the remaining that 5 is the one goes to the women. But 65 is men. The same men who have poor health-seeking behavior. What happens? It brings somebody down. So just to mention that, the other area that I wanted also to mention about men.
Before we go to that other area, I still want us to stick on this issue of the low health-seeking behavior.
Yes.
Last year, I was with you, the NSDCC, and we were talking about, of course, this conversation of how men are still quite doing badly in terms of just seeking, going for treatment, going for checkups. But has it always been like this, or did it go down? Because, we're talking about the old age where we used to see people with HIV, they presented those symptoms quite clearly. We see people who are bony, we see people who are, umekonda sana.
Yeah.
Those times we see placards, we see posters, kitambo. But right now we don't have such things that, would create awareness and tell someone that if you do not take your ARVs, you might just look like this. So would you say that this poor health-seeking behavior has gone down because now we are not doing much in regards to how we were doing before this art came in ART?
Yeah, and for sure I agree with you that Kenya, just to mention, has a young population. Yeah. And so you're right by saying that majority of them have not seen that person ambaye amekonda. And that is the first thing that we need to address. By ensuring that people understand that it is not the way somebody looks like. It's about protecting oneself. And the message that needs to be there right now is that we need to first of all ensure that we protect ourselves. Because when it comes to health, just to mention, when it comes to health, health is at various levels. I'll just mention from the question that you've asked. Number one, there is what we call to as promotive health. Promotive health means that we ensure that we are able to build our immunity early enough so that when diseases come, we are not able to get them. That's promotive, ensuring that the environment, ensuring what we are eating, and all that. But once that barrier is broken, we go to the second level. The second level is what we know as preventive. Preventive means that we have risks that are surrounding us. Yeah. At that point, if one is not careful, what will happen is that there will be entry. At that point, the risks are very near. Possibly we will not be able to address them, and therefore what will happen is that you can get infected. I'll give an example of COVID. When we say put on your mask, it's just because of the risk that is just around. But you need to do promotive to build your immunity by, of course, the issue that we have been told about nutrition, about the environment. Now, even HIV is the same, and the other diseases. So if you break the first barrier, which is promotive, preventive, if you break that other barrier, then what happens? Somebody becomes infected. Once infected, what comes in will be treatment. So for me, the critical thing that is here is that we have left out prevention. We only want to see, we only want to act when already the infection are taken place. Yeah. For example, for HIV, we continue telling people, you need to prevent yourself. There are various ways to prevent. So when young people, old people, everybody, when we say prevent yourself, there's HIV, it is a reality. But I was saying that now the perception of risk is low for those who have never seen people who are HIV infected and not on treatment. Yeah. But then the other thing is that by looking at somebody, you may not be able to tell who has HIV and who doesn't have. For example, by looking at me, you not know my status unless I disclose. Yes. So that is why we're insisting, prevent. Why? Because from the eyes, from just the look, you may not be able to tell. So every time, let that be within us, that there is HIV. What I need to do is to prevent myself. Yeah. If all of us would take that route, what will happen is that now prevention will become effective, and therefore the few because possibly it may not be zero. The few, where we want it to be zero actually, because our target is zero new HIV infections. So that now, those who are infected, of course it means that taking treatment for life. Yes.
So would you say we should go back to, the old age methods of awareness creation in terms of just spreading awareness about HIV?
Yes. The traditional, though also I'll be careful on the traditional.
Yeah.
The traditional one was the one that would put billboards and say AIDS kills. Now that we are not there.
We are moving away from that.
We are moving away from that, and then we are going now to possibly the media, the social media, when you want to target the young people. The prevention message still remains. We need to continue with it. But what possibly will change now is the method and the approach that we are using, because we need to unpack the ones that we are targeting and then determine which is the best method. For example, for the young people, we are strong with on media, social media, pushing things in the social media where they are, and therefore they can be able to get it. So I think that is the only shift that is there, but the message on prevention remains the same. But the other advantage is the options that we have for prevention have also increased. Yeah, they have increased, not the same. Right now, we are talking of new prevention technologies like PrEP. We are talking of PrEP, which possibly there before they were not there. But right now, there are various ways somebody can be able to use the technology and also the medicine to be able to prevent. For example, right now, if one gets an exposure, because of one reason or the other, I think it's always good to remember that you need to get attention within 72 hours. The earlier you get that medical attention, the better. Why? Because that way we're able to successfully prevent using PrEP. If that is to avoid, when you want to avoid. But the PrEP, which we call post-exposure prophylaxis, is that you know that you've been exposed. So what you're trying to do is within those 72 hours, you want to prevent. For the PrEP, it is possibly if you know you're vulnerable, you prepare. You can imagine all the options that have been given. And I think whether for men, everybody, and here men, because we are saying that you had asked about how we are performing, we have also realized that out of the tests, which I had mentioned, those who are turning positive from HIV tests that are carried out, they are more among men, though the number of men testing are fewer. You can imagine now tests women, we are getting around positivity of 1%. Test men, the ones who are being tested, it has now jumped up. It is higher than the one for women at 1.5%. It's slightly higher. That really tells us a lot, and that is why we still want to continue by paying, kind of paying that attention to the men so that they don't lag behind as we move.
When you talk about men, what age exactly are we looking at? Last year when we were having a conversation on World AIDS Day, Joshua, we talked about there's this trend where BAMBAs, of course, talk about poor health seeking behavior, how, of course, they're aiding in the spread of HIV among young girls, school girls. But what age are you looking at in terms of creating awareness, promoting better health-seeking behavior among men? Is it 15 to 30, or is it just all age groups?
Okay, that's a good question. Because when it comes to prevention intervention, we're interested in everybody, but we have categorized the population into age groups because the method or the approach is different. For example, we have really a campaign that has been ongoing, and I think that's what we discussed during the World AIDS Day, called Triple Threat. And with Triple Threat, our interest is 10, to 19. Now, if we look at 10 to 19, even age itself, and we are talking of three things: adolescent pregnancies, new infections, new HIV infections, sexual and gender-based violence. And we are talking of 10 years. We can try to trace where that child is.
Yeah.
That child is actually in lower primary school. If you look at it, it is lower primary school. But what we are realizing, and I'm talking now of the adolescent pregnancies, is that still they are presenting in the ANC where other mothers are presenting. Why? Because they are pregnant. Two things come up. How did they become pregnant? A man was involved.
Yeah.
Right? So what we are saying is that men in that aspect, even the issues of adolescent pregnancies, they can be involved because they can help to cause that change. Because in that discussion, at least a man was involved.
Absolutely.
So we can't leave men out. So that's one. Number two, issues of new HIV infections still. When we realize that at 10 to 14 years, still we are having children who are getting infected with HIV, and not necessarily from the mother to child transmission, which happens during birth and breastfeeding. But now the other reason, we always tell what it is. But still that age is too young for that. So I think what we are saying is we are mobilizing the society to say no to those adolescent pregnancies, to say no to issues to do with the new HIV infections among them, and also to say no to sexual and gender-based violence among that. So that is 10 to 19. But also we have 15 to 24 who are the young people. Also we have seen that really there is also a high burden among them. Actually, when it comes to new HIV infections, the proportion is high between 15 to 24. That's what we have. If you add that one to 34, you'll have taken almost 75% of all new HIV infections. So basically, that is where the statistics are, and that is why we are working together now to ensure that within this week that we are creating awareness among men and boys. It's not only them we are targeting the leadership, we are targeting anybody who can be able to take action to ensure that we are able to address issues to do with men and boys.
I beg your pardon. Now, before we wind up, Joshua, you have a summit in Elgeyo Marakwet.
Yes.
Maybe you can walk us through that as we wind up this conversation.
Thank you so much. Now, the National Endemic Diseases Control Council, as part of our contribution and within our mandate, we have also decided not to keep quiet. And therefore, we are mobilizing the society, not only in Elgeyo Marakwet, but throughout the country, And the purpose is one, to be able to have that discussion, to have that dialogue around issues to do with men and boys. Therefore, what we are doing is that on 16th marks actually the end of this awareness creation, or the 1 week of men, concerning man, the health and well-being. Therefore, on 16th, we will be in Elgeyo Marakwet, Tabash College. That's what we'll be, and with the leadership. So the national event will be there, where we would have the county government, the national government, or organizations that will be gathered together there so that we can have that dialogue. And why is it going there? When you look at the issues that we are discussing, we have decided to join the North and Central Rift, really for us to bring a number of counties. Actually, the counties in North and Central Rift, they will be there together with us so that we can be able to raise the awareness. We need to have some kind of discussions around this issue of men and boys so that the community and the nation can be aware and we start taking action. So it will target to create, it is a platform actually, to learn, to dialogue, to collaborate, and then see what we need to do. But even as we do that at that level, I would really request each one of us to take a challenge. For example, there's that boy, there's that son, there is that uncle. What can be able to do to say that that is our contribution? At the national level, we'll have almost 1,000 people that will be gathered there. The leadership, the community, everybody discussing this. Let's make it more of a national dialogue whereby we are saying that, yes, men will not be left will not be left behind.
Okay.
So the meeting is where? Tabach Teachers College. That will be in Elegeo, Marakwet.
All right.
That's where I'll be joining the country from.
Okay, my director is telling me we're overrunning this program. Thank you so much, Joshua Gitonga, for making time. Joshua is a monitoring and evaluation specialist at the National Syndemic Diseases Control Council, NSDCC. And the conversation we are having is about engaging men and boys as allies in ending HIV by 2030.
Yes.
All right. Thank you so much. Stay with us. We still have a conversation coming up on how to deal with choking if you choke on food. As an adult, as a child, as an infant, then what do you do at that particular point? You're watching Morning Cafe.